feel that, it's not that important to treat varicose veins. The problem is, varicose veins are caused by gravity pushing down on the leg and the blood flow in the veins trying to come up the leg. So you're always fighting gravity. And so every day, every week, every month, there's more and more gravity pushing down on your veins. And over time, those veins get bigger and bulgier and more spread out on the leg. And often the symptoms of aching or heaviness or cramping or throbbing get worse and worse as time goes by because there's more pressure delivered from the backflow in the veins. And so if we treat the veins with venous closure or phlebectomy or whatever mode we decide on, we can interrupt that progression of disease in the veins and make the legs much more healthy.
I had apprehension about, putting a catheter up into my vein and closing it from the interior, and thinking, geez, what was that going to be like, and so on. And for maybe 2 days after that procedure, I had a little soreness right over that area, but it wasn't anything that, it didn't stop me from doing anything. It was just recognizing that it was there. There was a little bit of bruising, but that was about it.
Mm-hmm. Okay. Yeah, I think many people do have a little anxiety, apprehension, concern, even after knowing about what the whole procedure is. They still say, God, are they really going to put this wire up there? Can I live without this vein?
Yeah.
How many veins do I have? How will it affect my heart, et cetera? Mm-hmm. So there's a lot of questions that, normal things,
Yeah.
I would, if I didn't know what I was doing, I would probably ask the same questions, But yeah, it is such a safe and easy procedure to do.
I was more concerned about the opposite of not getting it done. Was I going to throw a clot because of it and have it hit my lung, my brain, somewhere?
Sure.
So it was more of a medical kind of necessity for me to say, this is really big. These things are clotting. What am I going to do about this?
Yeah, that is very true. Because untreated, it is progressive because gravity keeps this force going down, the veins keep stretching, like a balloon being inflated. Eventually, it's not going to pop, it just gets overstretched. And that overstretching causes more pain, aching, throbbing, risk of blood clot, skin discoloration, ulceration, et cetera. So, yeah, for sure. There is a risk of not treating it, significant risk of not treating it. And that risk is higher than the risk of treating it, as you've proven, from your experience. So patients do ask me if treating varicose veins is a cosmetic procedure or a medical procedure. And there is a misperception among the community, even physicians, that varicose veins are a cosmetic problem. Well, the best thing to understand is varicose vein disease and venous insufficiency is a progressive issue because your veins are always fighting gravity that's pushing down on your legs. So untreated, varicose veins and venous insufficiency does progress over time and can lead to complications like blood clots and skin damage and ongoing pain. So the insurers do recognize that this is a legitimate medical problem and do cover it rather well in their medical policies. It's certainly not a cosmetic issue.